Mr. Chueri, the reason I'm here is because I'm doing an abdominal incision dressing change wound care on you, and that consists of removing the old Mefix, removing the old 4x4s, removing the old roller Kerlix, and I will be irrigating, and I will be packing it, and I will be putting 4x4s on it. And is that all okay with you? He says, yes, it is okay. So I wash my hands. And now what I do is, before we get started, would you like your analgesia? He does. So I administer to him 50 mcgs of PRN fentanyl, and then now I open up my sterile tray. Here's my drape. Here's my garbage bag. Here's my silver forceps and my 2x2s, and now what I'm going to add is I'm going to add into the field my 2x2s and 4x4s. And now what I'm going to do is I'm going to add in after this, I'm going to add in my 30cc syringe and my 20 gauge Cathlon. And now I'm going to add in my scissors and my cotton-tipped applicators. And I'm also going to add in my new gauze. I mean my roller Curlex, sorry, and also my normal saline. I wash my hands and I put on my clean gloves. And I'm going to remove the old Mefix and the old 4x4s. So I see there's a moderate amount of reddish pink serosanguinous drainage and it has a small amount of odor to it. I remove the old roller Curlex. For this old roller Curlex, there also is a moderate amount of reddish pink serosanguinous drainage and it has a small amount of odor to it. I wash my hands. Now I put on my sterile gloves. I have at least 10 cc's of normal saline. I irrigate from top to bottom in a zigzag motion. And I irrigate only the inside incision so the peri-wound remains dry. And I used up all 10 cc's. In real clinical, I would irrigate until it runs clear. Using 4x4s, folded in half. I dry the inner incision, and what I do is I make sure that my sterile fingers still remain dry as well. Last one. And now what I do is I get my two by twos, make them into rosettes. And then it's now dry. No, it's still moderately damp, and I'll use this to clean the peri-wound skin. One swipe left, top to bottom, discard of it. One swipe on the right side, top to bottom, discard of it. And now what I will do is I will get dry 2x2 rosettes. One swipe, top to bottom, discard of it. And then I'll do the right side as well. One swipe, top to bottom, discard of it. Just by looking at the wound, it looks to be a moderate, it looks to be reddish pink granulation tissue, and it's healing by secondary intention. Peri-wound skin is dry and intact and is slightly reddish. I'll measure the dimensions. It has a height of 15 centimeters. It has a width of 4 centimeters. It has a depth of 3 centimeters. I discarded it. I go through and I measure how much tunneling and undermining there is. Okay, so there's no tunneling or undermining when I measure the circumference. I will now pack it, so I'm using my roller Curlex soaked in normal saline. And I'm packing so that it fills up all the edges but doesn't go over. And now what I do is I get my 4x4s. And I cover over top. The last thing I do is now my hands no longer need to be sterile. I can remove my sterile gloves. I can wash my hands. And I apply the Me Fix.